Hello, this is I Care for Your Brain with board certified neuropsychologist Dr. Karen Sullivan. That is me. We are here every Wednesday at 6 o'clock to talk about a topic within the brain health community with the goals of empowering and educating. When you don't understand what's happening to you, it is an unnecessary level of pain and distress and anxiety. And I think an easy answer to those struggles is more brain health education. So we have been here together for 4 years, going on 5 years, and I am so pleased that you have let me into your life as a trusted source of information and support. So thank you so much. Tonight's topic falls into a category that gets the least amount of publicity as a contributor to brain health. It's only been about 15 years that social interaction has been verified by scientific research as being an important contributor to brain health and mental health. Our brains are wired and optimally function with continuous face-to-face contact. In particular, specifically, our brains are designed to meet the demands of living in a group. Our brains are designed for social cognition, which has been defined as a complex cognitive process related to perception, understanding, the use of language, auditory, visual, and physical cues that help us communicate in the interpersonal world. We have parts of our brain that are specifically designed and significantly light up when we are interacting with other human beings face to face. We have the fusiform gyrus, which lights up most strongly when we are with familiar faces, and we have the face selective neurons in the amygdala, which are most stimulated when we encounter new faces. This is as part of the threat detection system in the subcortical part of the brain, the emotional part of the brain. Eye tracking research has given us a tremendous insight into how very important faces are. So this is a really cool research paradigm where you show individuals anything in their visual field, and you can actually latch on through infrared technology to the pupil and look at exactly where the eye is directing the brain to pay attention. The minute we see any object, we start scanning for a face. We see faces in objects that even have a minimal qualification for 2 nostrils and 2 eyeballs. A newborn infant prefers a face over any other object. We know this even if we are looking at clouds. Sometimes we have websites. I saw one the other day where cut down the middle bell peppers are looking like faces. We are very, very much seeking information about faces all the time. Looking at faces, interacting with people, eye contact to eye contact is very stimulating to the brain. And what we think is really responsible for a lot of that is that direct eye contact. So this is a very hardwired social cue that provides confirmation that someone is paying attention to us, that we are worthy, that we are getting our point across or not, that we are being accepted or not. We are gathering what we call micro facial expressions at an unbelievably rapid rate. This is at the level of the millisecond. We're very much not conscious of it. It's just something that the brain automatically does just based on very subtle significant changes that we're noticing specifically in the eyes. It's absolutely amazing how much information we can get from eye contact. And it's that subtle face-to-face information that we use to perceive how is this social interaction going? Is it going good? Am I getting these subtle signals from someone that they understand what I'm saying, that they're giving me their full focus, and that I am a priority to them in the conversation? This started to be of interest to researchers in the early 2000s, but probably the most influential study done on face-to-face contact was published in the Journal of American Geriatric Society that looked at how different types of social contact affected mental health. And what they found was that people who got together in real life at least 3 times a week with family or friends were about half as likely to report symptoms of depression as compared to those with no social face-to-face contact. And so they looked at people who talked on the phone, they looked at people who were emailing, and it just did not seem to have the same protective effect. And so what the author said is that we see a powerful dose-dependent effect with in-person contact. So the more face-to-face time someone had, the lower their rates of depression. So that's pretty interesting. So the basis of why the researchers think it was so important to be in person as opposed to email or on the phone, it was the face-to-face contact and how this supports social cognition and communication. It may also be that we are less distracted when we're with someone face-to-face because we perceive that it would be rude to not give good eye contact. We would know that somebody might think we're not interested in what they're saying if we kind of wander off with our eyes. We can also start to multitask when we're on a text or on a call, can't we, right? If someone can't actually see us, I think the truth is a lot of us are cramming in other activities at that time, not really giving our full attention. So the reason this is important for you all, our awesome brain health community, is because this is a form of brain stimulation, right? You wouldn't think of it because it almost sounds like it's too easy, but this is a cognitive exercise. So someone asked me about apps for different types of cognitive therapy. And certainly there are some out there that are pretty good, but we don't want people to forget that conversation, face-to-face conversation, is also a form of brain exercise, and it's free, okay? So as I said before, when we are talking with someone, it might feel like kind of a passive activity, but the truth is our brain is in high gear. We are processing a ton of nonverbal information. There was a study that just came out this year from the California Institute of Technology and Columbia University that wrote that a face-to-face interaction presents the human brain with the most complex form of information processing. They said the computations that the brain must perform occur in parallel, left brain, right brain, combine social and non-social cues, and force us to produce verbal and nonverbal signals that involve multiple cognitive systems: memory, attention, emotion, and learning. So what I want you to get out of that is it is not low on the brain's activity to interact with another human being. Now, obviously, the barrier we need to talk about nowadays that is getting in the way of face-to-face time is COVID. This is taking a very severe emotional and social toll on people. In the first few months of the pandemic, there was a lot of research coming out, and emotional distress basically tripled across all populations. The stronger COVID was in someone's area, the more emotional pain and distress people were reporting. Now, what's really sad about COVID is the folks who are at highest risk for the negative effects of COVID, older people, people of color, people with low income, people who live in group care situations, they are disproportionately affected by loneliness anyway. So what we're really worried about is the impact of COVID isolation versus people that were maybe already isolated. So it depends where you are in the brain health community, but this could certainly be you or your loved one. And what we really get worried about, where there's been a lot of good research, is the effects of long-term isolation, the lack of face-to-face engagement. We know that this is very bad for the brain, the person, mental health. Turns out it's also not so great for the heart and the immune system. So they've looked at populations of people who have long-term isolation as part of what they do. These are people like prisoners, astronauts who go into space, even people who do research up in the Antarctica. It's pretty interesting. And what they've shown is that the longer someone is by themselves without getting that stimulation of social contact, they can have negative cardiovascular issues, which they think is related to an increase in stress hormones, okay? So according to the American Psychological Association, just the perception that you feel socially isolated negatively impacts our immune system through a process of inflammation and decreasing the body's antiviral response, which of course then increases your risk of getting any viral infection. But the effects of social isolation are not just in the here and now, they're also in the way far future. So there was a study in the American Journal of Public Health that showed that older women who had a larger social network had a 26% less risk of developing dementia and cognitive impairment as they got older. And what they think is that this is related to not having that stimulation. And the problem is that we kind of disregard social time sometimes, and it turns out it's actually a very powerful form of cognitive exercise or brain stimulation. So the logical question I would have is, okay, well, how about things like FaceTime, Skype, Zoom? Well, it turns out it's certainly better than nothing, but it just is not the same. And part of this relates back to eye contact. So this is the thing about micro expressions. Now, if you're someone who is in the Parkinson's community, you know exactly what I'm talking about. So in some folks with Parkinson's, we can get issues with the tight facial muscles, and it's hard for those folks to express communication, and it's hard for us to pick up on it. There are still times, after seeing hundreds and hundreds of folks with PD, in the interview, I will still catch myself as a social creature thinking, oh gosh, do they not like me? Am I boring them? Because I'm not getting that subtle unconscious feedback from their face that's kind of showing that they're with me in the conversation. That's why it's so critical to check in with some folks who have that condition, because the face doesn't necessarily communicate. So these microfacial expressions, they occur without us knowing. They are totally unconscious, but remember, they're communicating vital information. The problem on something like Zoom is that they aren't being transmitted in real time. So even if we're a couple milliseconds behind perceiving someone's facial expression, it interrupts the flow of the conversation, it interrupts the flow of the connection. So if you've been on any of these platforms, and I'm doing all of my practice right now through telehealth, and have been since last March, the problem is you can have these kind of really awkward exchanges with people where you talk over each other, where you misperceived, where maybe you had a misunderstanding because you're just not in that succinct flow with that other person. So basically what we think, like I said, is this is better than nothing, of course, and I want to give you some recommendations at the end of this for how to try to remain social and safe with COVID. But what we know is that when those little micro expressions are kind of broken down, that this is where a lot of misunderstandings can come in, and this is even where fatigue can come in. There was a 2018 study that was done by that same researcher I told you about a few minutes ago, who did the study showing that face-to-face time was better than email and better than text or phone. But he, about 3 years ago, decided to go back, and he added in another experimental group was using video chatting, okay? And so what he found was that video chatting also helped to reduce the risk of depression, particularly in folks over 60. It was definitely more effective than email, more effective than instant messaging, and more effective than social media. So he concluded by saying that it lacks many of the benefits that you would get from being in person, like being able to reach over and touch someone to emphasize a point, but that it is very important that we are still getting that nonverbal communication skills. It might not be in real time, the benefit you would get from in person, but it is certainly better than nothing. So let's talk about how you can put this information into action. That is my intention in being here with you, is educating you, empowering you with some really interesting, cool knowledge. But what really matters is, what do you do with this information that I share with you? So I want you to just think about how you can elevate the impact of social importance on you, especially if you are in the brain health community. We often talk about layers of pain and disability and impairment, and you don't need another layer by isolating yourself. Now, in a future Brain School lecture that we're going to have, what we're going to talk about is how to make socialization your way. How you don't have to be an extrovert if you're not. You don't have to be someone that likes to go to parties. What we're really talking about is even one person that you truly value, that you truly feel like is your person, that you can really let your guard down with that person. There's one research study that showed if you just have one person that you could call at 1 o'clock in the morning with a flat tire, and you could 100% guarantee that that person would come and help you, then you are socially connected, okay? So sure, it would be ideal if you had, 5 to 10 really close friends, but the truth of the matter is, even if you have a very small group, spending face-to-face time with them is part of what matters. So what I want you to think about is, I would choose something like FaceTime or Skype over something like Zoom. There's data out there to suggest that it's a bit of a quicker transmission. I would try to schedule regular calls with family and friends. Start a text chain, an email chain where you talk about, what you saw in the news that was good, podcasts that you've listened to. Catching up with old friends through Skype, through FaceTime. Sometimes it feels like there's a little social anxiety to that, but the truth is you're going to get all of those benefits of the socialization much more if we meet together face to face. People are doing virtual happy hours. I'm sure that's something Joe is doing out there in Los Angeles. And there are plenty of things if you just kind of think about it different. So I want you to really try to value, especially face-to-face time. We also know that having a brain health condition can be socially isolating, right? It's hard to go back into the world when you don't feel like yourself. People can sometimes not be the nicest if there is a visible symptom that's part of your brain health challenge. But don't let them take away this form of brain exercise, brain stimulation, neuroplasticity, reduces your risk for depression, reduces your risk for dementia, for goodness sake. I mean, it's really unbelievable. If this is the kind of topic that you would like to have a deeper dive on, I would love for you to join me at Brain School next week, September 9th at 6 p.m. Eastern Standard Time. When you sign up on our website, there'll be a link down below. You get a connection to a live Zoom with me, which has been about an hour and a half to 2 hours each time. You'll get a 68-page PDF workbook that specifically goes with this lecture. The title is The Importance of Social Connection. It takes a village. If you can't be there with us live, you will have access to that link forever and ever. You could watch it as many times as you want. And in these workbooks, we have not only my PowerPoint slides, which can be very helpful for getting the full use out of them, but we also have those motivating tools to help you put this information into action. It is a brain health education program in a lot more depth than what I can offer you here on these 20-minute Facebook Lives. So we've had quite a few people at each Brain School. It's been a really positive experience for me. With my schedule and some things that we have coming up in the next year, I don't think I'll be able to do Brain School again. So if you're into it, get into it and meet us over there on Zoom. Thank you guys so much. We've had some really important conversations on the Facebook page this week about communicating with brain health providers, which is informing an upcoming downloadable card that I'm going to be working on. And on one side, it's going to have how you can best be prepared for a medical appointment with a brain health expert and suggestions of how they can be best prepared to meet with you. So we're going to kind of do both sides of the coin because we have to move the needle on communicating further. I've had just too many patients, and I mean, this is always, but in the last few weeks, just very upset with how their neurology appointments went, very upset with where their care is at, and we have to do more. That's just the bottom line. So I bring to the table some insight, and you all bring to the table some insight. And so I've opened it up for comments on the Facebook page. If that's something you're interested in, please go over there and let me know what is important to you in those brain health medical provider exchanges. Thank you all so much. You're all so precious and special to me. I really appreciate this time together every week, and I hope you all have a wonderful week until I see you again. Next week, I am going to be talking a little bit more about etanercept, which is that stroke medication that we talked about a few weeks ago. We are going on an advocacy mission with that, me and a fellow listener, a fellow stroke support survivor person in the community. We are going to join forces to try to do something about that because I just was hearing way too many stories that we have to do some advocacy. So I will definitely need your help then. Thank you guys so much. Have a wonderful week. Bye-bye.